Super. So Trisha, I'm going to have you hold this, and we're going to look together. The chart it's inverted. So this is your right side, this is the left side, and we're just going to look at this very top line here. And so if you take a look, we have numbers all between 1 and 3. We do have then a 6, a 5. If you drop down to the inside, same thing. We have some 5s here, some 4s over there. I'm going to drop down to the bottom on your lower right, and again, we'll look at this top number. We have 4s and 5s. Then same thing on this inside there, 4s and 5s. If you take a look here, where would that place you?
Between slight and moderate.
Trisha, you're exactly right. You are the slight to moderate periodontal disease. So the problem is that we not only have infection in the tissue, but you also, as you can see here, have infection in the bone. What I want you to understand is that the consequence of not treating this is that it can continue to progress. Just like you see in this picture, you can continue to lose more bone really without you even knowing it. It's a very silent disease. So what I'd like to talk to you about is a non-surgical solution that we can do right here in our office. So we can do non-surgical periodontal therapy, and you're so lucky that you're only in this level 3. And so what we do, we clean that infection out. We call that root planing. We get you numb, just like you've had your fillings done in the past. We keep you totally comfortable. And we use our special instruments that kind of put some oxygen in here, and we clean all that infection out down there. Then we're going to actually, what we do called an irrigation. And so we have prescription strength medicine in our water, and we'll actually go all around the tooth and coat that medicine down underneath there. Then to help support you at home, since once we've cleaned this out, we want to make sure you have the right tools at home to keep it cleaned out. We'll put you on an antioxidant rinse, and that's actually to get the tissue to start healing. So you'll swish with that once a day, get all these tissues where the bleeding and swollen to actually start to calm down, and it feels really good. Then I'll be sending you home with a prescription toothpaste called xylitol, and that's to be brushing your teeth because we don't even want the bacteria to start to reaccumulate on the tooth surface even. Then, depending on how much and what types of bacteria you have, we actually want to grow good bacteria. So have you heard of probiotics before, like for your stomach? We actually have probiotics for our mouth. So we're going to grow good, healthy bacteria right in your mouth, which will fight the infection from coming back. Okay. The most important piece of all this therapy is the Sonicare. And that's because once I clean this out, I want you to have the same technology as my instrument that I use here, and it forces oxygen underneath that tissue. So I'll show you that day how to use that. You'll use your Sonicare twice a day, and that will help keep that clean really long term. All right. Any questions about the treatment so far? No. Super. So your diagnosis here is going to be this chronic, just like we picked, the slight to moderate. But I want you to take a look through these contributing risk factors as well as these oral systemic links. Anything on here that you would check off that may be contributing to this infection?
I am in menopause and I've had cancer.
Great, so we'll talk about that. You understand with menopause, we definitely can have some hormonal changes that can affect the tissues. So your absorption rate and how you fight infection, believe it or not, is very influenced by that. So that it definitely makes you more prone to periodontal disease and the breakdown. And then as well as your cancer, because you've been through cancer, I know through radiation and chemotherapy, right, your immunity has been depleted. And I know you've told me things on trying to help build your immunity up. So it's going to be very important that we help you fight off this infection because believe it or not, I tell my patients, your head is connected to the rest of your body. So if we do have infection here, just as you see, it can make its way into your bloodstream and can contribute to other diseases such as cancer, and I want to make sure that we're not doing that. Okay. Any questions about that? Super. Because you are high risk with the menopause and the cancer, I really want to find out specifically what is causing your infection. That's going to be really important. So I want to go over that with you because we have today something that is really simple and easy but so powerful, and it's called a saliva test. Okay. So here's an example of that test, Trisha, and it just takes 30 seconds. It's saline, we swish and spit it, and we send it off to this lab called Oral DNA Labs. And what they're looking for is these top 11 bacteria. As you can see, we have low, moderate, and high risk. So one, as a cancer survivor, I want to know, do you even have any of these bacteria that can get in the bloodstream and travel other places? If you even have them, then more importantly, how much do you have? And what's so great is that this is like your fingerprint. This is just to you. It's very specific. They'll tell